In terms of the differences, it's actually going to really revolve around what's the difference in the type of tasks that are asked of an adult and what are asked of a child. For children, the hardest task might be the assignment at hand or following the direction for assignment with the teacher or listening to the teacher or even just completing assignments and turning them in. For an adult, the issues might revolve more around I can't read the chapter assignments, the reading assignments given to me by my professors. I can't complete the data analysis that my work wants me to collect. I can't review all the employees that are my subordinates now that I'm a manager. Looking deeper, an adult is going to have challenges with staying on task and organized, right? The tasks I typically ask of an adult would be like household chores. Is your house orderly? Are you able to keep up with the chores, the bills, the kids' sports and the kids' school time? Are you constantly late to things? With work, are you constantly unable to keep up with your surveys? Are you making a lot of errors, right? Hey, look, you're supposed to be putting blue tags on these items and you keep putting red tags scattered throughout. And for the academic student, it's going to be, hey, are you spending hours creating a study guide? Are you not grasping the material despite spending days studying it? It is very important to get an evaluation for ADHD as soon as possible and before a student is on academic probation so that we can have a student succeed. Early successes are really important to development because essentially, if you're having trouble understanding material, paying attention to the lecture by the teacher, or completing the assignments, you're just not going to learn the information. Early on, you might not have a lot of success with tests or academic accomplishments, and you're going to start to wonder, am I dumb? Are you going to be insecure? The other layer is the hyperactivity part of the ADHD treatment. If you are particularly having the hyperactive symptoms of ADHD, you may be called on a lot by the teacher. Please stay seated, or please finish your task before going on to the next task, or a number of different things that the teacher might call on you for. If you are picked on by the teacher, or if there's a spotlight on you by the teacher, they might put you in a position where the other kids start to recognize, hey, look, something's different about Joey. I don't know what it is, but I'm not going to hang with Joey. So if these kids start hanging out with the other kids that get low grades, or hanging out with the other kids that the teacher tends to dismiss early or put in detention, this can significantly impact a person's overall academic progress and long-term development because they're essentially now hanging out with a different peer group. In terms of my first recommendation, is just get back to the basics. Are you using an agenda planner? Are you using a to-do list? And honestly, everyone has a cell phone nowadays. If you're not using the calendar in your cell phone consistently, if you have a to-do list that's easy to add to and easy to edit, I would say really start with that. And you might notice like, hey, I'm forgetting less things. I'm getting through that task. You can have the agenda, you can have the to-do list, but you got to follow up with it. If you don't keep up with the agenda, if you don't keep up with that to-do list, it's not going to help you. And so it's a really great tool that we've been told all of our life that it is really something that we can always get better at too. So using a to-do list, using an agenda. They're two different, yeah, the best way to answer this is in two different parts. So let's talk about medication management in terms of ADHD. The symptoms of ADHD typically focus around difficulty with organization, impulsivity, sustained attention, staying on task, completing tasks, and tedious tasks. If reading a chapter in your book takes 100% effort for you to read one paragraph, the idea is that medications, when properly titrated, can eventually make it so that reading one chapter now can take 70% effort. That's a difference where you're going to have a massive change in the amount of effort it takes for you to complete a task, to stay on task. Therapy is the second part, it's the supporting part of it, right? The brain is a muscle. You can be more organized, you can sustain attention better. It takes practice. Sometimes at the beginning, just like there's reading one chapter versus one paragraph versus one sentence, sometimes staying on task and completing a homework assignment for 5 minutes is all you can handle. You can gradually increase the amount of sustained attention that's demanded of you. So for 5-minute study sessions, 10-minute study sessions, 20-minute study sessions, and get yourself to the point that you eventually can sustain a 30-minute study session. 5 minutes or 10 minutes might not sound like a lot of time, but if you're sitting in front of a project for an hour with very low efficiency, it's because how much of that time are you spending actually trying to effortfully get yourself to complete a task? Together, if we can decrease the amount of effort it takes for you to complete a task with medications and also increase the style and methods that you use to stay on task, to become more organized, to complete assignments, to reduce distractions, together that can help you instead of taking days to complete an assignment, complete that same assignment in an hour or one sitting. The first thing is patience and understanding. Sometimes when you ask a person, did you take your medications? What you're saying might be different than what they're receiving. They might feel that you're watching them with a magnifying glass. You, as a caring a friend or family member, might not know how else it's like, hey, I just want to make sure you're okay. So sometimes the best way you can support them is why with patience and offer more opportunities. Again, organization, agenda planners, sustained attention, anything you can do to decrease distractions around them, provide more opportunities for organization. So making sure that they have an agenda plan, make sure that they're using the agenda planner. Don't write down the appointments for them. Teach a man how to fish. Don't give them the fish. Patience is a big part of this. Some tasks will take a lot more time for persons with ADHD to complete and a lot more reminders. Stay patient with that. And eventually you'll find that they could, with practice, instead of taking 5 minutes and being done, they can do 10 minutes, another 20 minutes. Part of it is actually just being honest with you. Hey, look, you took about an hour to read that paragraph, and I don't really know if you grasped it so well. Do you normally take about an hour to read this kind of assignment? Sometimes if you recognize, maybe that's the best case advice, that if you recognize that a person takes a really long time to complete an assignment, you can ask it. Does it normally take you this long to complete a survey for your employee? Does it normally take you that long to read a reading assignment for your teacher? Does it normally take you that long to finish the dishes at night, to complete a chore? Having that conversation in a supported way, not trying to say you might have a problem, but just say, hey, look, this is how long I take. I think you'll have a lot of success with helping out a family member or friend that might take a lot longer to complete the same assignment.